Now you can refer more patients for an urgent community response in Buckinghamshire. You know those times when an adult's going through a physical health crisis, and if something doesn't happen fast, they will be taken to hospital and probably admitted? But actually, they could be managed at home, if only there was a different solution instead. For patients of Buckinghamshire GPs, the Rapid Response and Intermediate Care Service, RIC, can be that, if only. We have now added paramedics with advanced skills and nurses alongside our highly skilled physios and OTs, rehab assistants and healthcare assistants. We can see people at home within 2 hours or 2 days if it's less urgent, as an urgent community response. We conduct a holistic and clinical assessment in their own environment, keeping them safe at home, enabling them to recover their independence with rehabilitation or care for minor illnesses and infections, short-term support for activities of daily living and personal care, and equipment needed urgently. Our patients' medical care stays with their own GP. This includes undertaking medication reviews. We will liaise with the patient's GP, specialist and support services as necessary to keep the person at home, but if required, we will arrange transfer to hospital. Our service is based on people's needs, not specific conditions. They might have had a fall without serious injury or loss of consciousness, and without a medical emergency or fracture. Minor illnesses or infections like UTI or URTI, increased or new confusion or acute worsening of delirium or dementia. They might need urgent catheter care, if unknown by the district nurses, or urgent diabetes support that risks admission. They could have reduced functional ability, reduced activities of daily living, or decompensation of frailty. They might need equipment urgently. They might need crisis support for palliative or end-of-life care, or when care from family or friends breaks down and hospital admission seems the only option. To refer, phone 0800 177 7789, 8 a.m. to 8 p.m. every day. We'll connect you to a clinician in our teams. If only you could avoid their admission to hospital. Phone RIC for an urgent community response. Here's a reminder of who you can refer and when RIC is not the right service. Phone us.